Good afternoon, everyone, and welcome to the second of our weekly COVID panel discussions with key community leaders. This is an event organized by Tallahassee Memorial Healthcare and reflects amazing cooperation and collaboration across the entire Leon County healthcare community, including TMH, Capital Regional Medical Center, the Leon County Health Department, Leon County Government, the City of Tallahassee, Bond Community Health Center, and the Neighborhood Medical Center. That's quite a collaboration. And we know there's been intense interest in this based on the registrants. I'd also like to recognize our partner, the Village Square, which continues to promote civil discussion and discourse in our community. And a special thanks to Partners in Communication, which will have a sign language interpreter vainly trying to keep up with my rapid cadence and translating today and on future webinars. Finally, a special welcome to our new radio audience on WFSU, which is broadcasting this Monday at 6:30. So tell all your friends if they've missed this webinar that they can always catch up on WFSU. My name is Skip Foster. I was the publisher of the Tallahassee Democrat, and I'm currently a marketing consultant, and I'll be your moderator today. Before we start, if you missed the first webinar, you can find a recording of that, as well as a comprehensive FAQ document, which the mayor of Tallahassee challenged us to put together. We had that, we've expanded on it. It's continuously updated with key information. All of that is housed and much more at tmh.org/coronavirus, tmh.org/coronavirus. Great thing to bookmark for a lot of information. So let's get started today, and we're going to go right to Claudia Blackburn, who is the health officer for the Florida Department of Health in Leon County. And we've got breaking news, Claudia. First, I understand that there's some new doses coming soon to our county, and also that the state has just announced a new vaccine appointment pre-registration website at myvaccine.florida.gov, myvaccine.florida.gov. So what can you tell us about all of that new news that's just come out here in the last hour or so?
Good afternoon, everyone. Thanks for that question. The Florida Department of Health in Leon County is now included in the new state COVID-19 vaccine appointment system. Appointments for DOH Leon COVID-19 vaccination sites can be scheduled using the system starting immediately. Seniors age 65 and older, frontline healthcare workers, they can call 866-200-3856 to request an appointment. And for those requiring TTY access, the phone number is 833-476-1455. And as you said, Skip, it is myvaccine.fl.gov. What I want people to know is that we have the list still that I have talked about. We have about 5,800 people remaining on that list, and we will continue to work through that list. We are in the process of being trained and getting organized to transition to this new system, but we will continue to use our current system until we have made that transition. So it's not necessary to register if you're already on our list. And if you're not on the priority group and you register, you'll be in the queue, but you won't be in the queue for the priority group that's currently being vaccinated.
Can you repeat those two phone numbers, please, Claudia?
Yes, 866-200-3856 to request an appointment. And then for those requiring TTY access, the phone number is 833-476-1455.
And the website is myvaccine.florida.gov. And then there's new vaccines. We just got word on some new doses coming, correct?
Yes, we will be getting additional vaccine on Monday, and I believe we got some second doses today. So we'll be working on our distribution plan and clinic plan for next week.
And how many did we get?
I believe it's 2,925 doses.
And can you list the names of all the people that will get those? Just kidding. Just making sure everybody's paying attention. And so that will get you, your waiting list, you said, was the list that you have now?
5,800.
Okay, so that'll knock out about half, roughly half of those?
It should.
Okay, great.
Although it's not all for our waiting list. It's also going to healthcare providers. And so some of those people are on our list and some aren't. So.
Okay. So just if to continue down that road with you for a second, can you just give us a little bit of an overview of the numbers now, where we stand with, you know, how many people in the county are actually in that first group that is eligible, and where are we percentage-wise on the first and second shots?
Sure. Well, we estimate that there are about 40,000 people that are 65 and over in Leon County, and maybe 11,000 healthcare workers. We don't really have a solid number on that. Of this group, 19,593 people 65 and over, or about 49%, according to my calculations, have been vaccinated, and probably about 71% of healthcare workers, if we estimate 11,000 healthcare workers. Also, in terms of African Americans that are over 65 that have been vaccinated, we're working on getting more data related to the racial breakdown. But it looks like about 17.9% have been vaccinated. It looks like about 1,308 out of 7,309.
That's great. So thank you for that update. We'll be back to you shortly, but I want to turn to Dr. Watson. We've been getting some questions about folks that are under 65 and have underlying health conditions. How are we handling that issue locally, and of kind of who of those people are eligible and are getting the vaccine?
Right, thanks, Skip. So you're talking about the vulnerable population defined by the governor.
That's right.
So as of today, as of the time sitting in this chair at this moment, because everything changes hour by hour, we are still laser focused on 65 and over, working with Claudia, working with Bond, working with neighborhood, and working with CRMC. We're all the great partners, all of the providing partners here in the community. You heard Claudia mention the 2925. Because of Claudia and her team's good work, you know, she distributes out to TMH, who then distributes out to all of the healthcare providers in the community. And through that partnership, that's why you're seeing Leon County do so well, because of this true partnership in this unique environment. And it's just a pleasure to be a part of that. Now, when you look at vulnerable populations, we have to have a supply of vaccine and a designation, a specific designation to do that. Hospitals have a designation that they can look at patients and determine who's vulnerable, but that still requires vaccine. So we have been focused on getting the 65 and over taken care of first. And then once we have a designated supply, we will look at our vulnerable population. And let me remind everybody that CDC has a great description of vulnerable populations. We're following that. Also, the vulnerable population should be defined by the providers. That's the best group that can look at these folks and say, you know what, I recognize you. I know that you're high risk. You're on our list. But splitting this, you know, if we go after 65 and we go after vulnerable and we go up, it's really going to dilute out the process. Last thing I'll say, 65 and over are defined as vulnerable populations. So we need to remain focused, continue to follow Claudia's lead, continue to push out to the community, and continue to be successful in what we've been doing.
Okay, thank you. Thank you. That a lot of questions on that, and I appreciate your response there. Dr. Blake, if you look at the state hospitalization trend on the DOH site, it's really been declining over the last week or two. We're a little fuzzier on what our trend is. To talk a little bit about that discrepancy, and what are you seeing at CRMC, and What should we read into those numbers, if anything?
Yeah, thanks for that, Skip. I'm happy to report that our hospital is seeing a solid downward trend in hospitalizations. It's been a little bit of a slow trend, but for example, on January 15th, we peaked at 87. About the next 8 to 10 days, we averaged into the 70s. For the last 2 to 3 days, we've been into the 60s. I'm happy to report that as of right now, we're at 55. This is the first time we've been less than 60 since Christmas. So it appears to be a solid trend. We're very happy that we are catching up to what the rest of the state is seeing.
So is that what is that a product of? Well, it's too soon for the vaccine to really be driving that number down, right? What do you attribute it to?
That bump really appeared to be due to the holidays. There were people that traveled, there were family gatherings. We unfortunately had people that got admitted that knew they caught it at Christmas dinner because everyone else had tested positive. So now that the holidays are over, less traveling, less family gathering, hopefully everybody's adhering to mask and social distancing, we'll continue to see that trend head in the right direction.
By the way, Dr. Blake is the Chief Medical Officer at Capital Regional Medical Center, and Dr. Watson is the Chief Integration Officer at Tallahassee Memorial Healthcare and Capital Health Plan. I was remiss in identifying them by their title. I won't make that same mistake with Dr. Damon McMillan, who is the Chief Medical Officer at Bond Community Health Center. And Dr. McMillan, we got some questions last week and even after the webinar about the low percentage of African Americans that have received the vaccine locally. As a percentage of those who have received it, it was low. So I wanted to get your thoughts on what is being done to reach the African American community and improve those numbers. And thank you for joining us today. And don't forget to take yourself off mute. You've got to do that 100 times to catch up to the number of times I've done it, though.
Thank you very much, and I appreciate the reminder and appreciate this opportunity. And as you've mentioned, this has been discussed before. There has been a reluctance, a wait-and-see mentality in many of the diverse communities. If I understood the numbers by Ms. Blackburn related to the increase in the percentage or rates of vaccination among the African Americans, that's more in line with what I've seen, because certainly as when we started off, there were very few who were interested, but that has picked up. We're continuing to see that. And as we continue to be in the communities, not only vaccinating, but also continuing COVID testing, people are being more aware of what's going on, getting educated, and it's been helpful in dispelling some of the concerns that the diverse communities have had. So we encourage any discussions with social organizations, if there's any social events or virtual events where we have the opportunity to educate, we encourage people to continue to do that. And if they have questions, certainly we have a phone line here at our office where we're asking people if they have questions or looking to get tested. Of course, they can call, but we are still trying to focus on making sure that our population is receive the vaccines according to the 65 and older guidelines.
Thank you very much, Dr. McMillan. I want to turn to Jeanne Freeman, who is the Chief Executive Officer at Neighborhood Medical Center. And Ms. Freeman, we've got a viewer question submitted that I'm ashamed to say I had not considered, and that was, how is COVID impacting our homeless population, and how are vaccines getting to that population? What can you tell us about that?
That's definitely a good question. Leon County has been working with the homeless shelter providers to isolate individuals and families that have been experiencing homelessness who either test positive for COVID or are awaiting COVID results. So with that, we're able to identify those persons who are 65 and up who are eligible for the vaccine and work with those providers in the community to get them vaccinated as quickly as possible. Now, that does take a lot of groundwork. Right now, we're in the process of the point in time count, and that identifies the homeless residents in our area, and we can locate them, and then from there be able to assess those people who are in need of the vaccine, or even those who are maybe having symptoms of COVID and getting them some treatment right now. So to date, we have about 30 individuals and families that have been identified in need of COVID support.
I want to follow up with you and ask you about elderly populations, and in particular, what I'm going to call the really elderly population, and folks that may not be not only not proficient with a computer or online, but even navigating the system by phone. What do we do, and what are we doing to keep those folks from falling through the cracks?
It's definitely a labor of love. We've seen, since we've been doing our vaccine clinics, a lot of elderly people who are showing up to get the vaccine and they don't have the assistance that they need to help facilitate that process. We actually had a situation where one person came in, they didn't remember that they had the first dose of the vaccine. So being able to rely on Florida Shots to check, back and forth to see if people have had the vaccine is definitely something that has been a benefit to neighborhood, and I'm sure Bond and all the other providers in the community. It's very important that if you know of someone who is elderly and doesn't have that support system, help facilitate the process with them. Reach out, see if they need help. You can definitely visit our website, fill out the form for them. We will reach out to you to help facilitate getting them that vaccine, because it's very important that we act as neighbors in this process, especially for those that don't have family members.
So are there any nonprofits in town or other organizations that are specifically working on this issue? And if I wanted to volunteer, say, hey, I want to make sure there aren't any 100-year-olds that are just, basically not being, don't know what to do and are falling through the cracks. What could I do? And this is for the whole group. And I'm going to start with you, Ms. Freeman, but anybody else can chime in. How do I engage? How can I help on this?
Well, you definitely can reach out to us. Like I said, you can visit our website, complete that form on behalf of your neighbor, and we will reach out to you within a couple of hours. I would also ask that you reach out to United Partners for Human Services. That is an organization of nonprofits in our area that can help you facilitate that, and they can get that information to some of us on this call, and we can facilitate access a lot quicker.
Anybody else have any suggestions on that front before I move forward?
Hey, Skip, this is Kevin with Leon County.
Yes.
Just like to remind everybody who's listening, if they're interested in helping in any way, they could connect through Volunteer Leon, the county's volunteer center, and they can help make matches, whether it's helping the county's health department with their vaccine clinics, or any of our other nonprofits that may be engaged in activities, even Bond and neighborhood here on the call, our partners here. They can help make those volunteer placements, and that's Volunteer Leon through Leon County government.
Is there such thing as home visits? A viewer is asking, are there home visits to people that may not be in a facility but are still homebound-ish? Is that something that exists, and how does that happen? Anybody know?
It definitely exists. Right now, Dr. Robinson and I are working in partnership with Senator Osley to figure out how we can go out into these communities and start to vaccinate people and get the education that they need in those small areas where they aren't able to get into a doctor's office or even have transportation to get there. So that's definitely something that's on our plate right now.
Is it fair to say that this is an opportunity area for folks to get involved and help, or do we have this taken care of and are pretty confident that we aren't having anybody fall through the cracks? I don't want to make an issue of something that isn't there. So is there an opportunity here to help, or do you think we have a handle on it?
I definitely think there's an opportunity to help. I think that it just needs to be a streamlined process.
Sure. Okay. Well, boy, I think this is, if you're on this call, and I know a lot of folks are on the webinar looking for how to get themselves or their loved ones taken care of, but if you're also just a community advocate and want to help, I think this is a good opportunity to do that. So Kevin, you chimed in there, and I appreciate you doing it. Kevin Peters, Director of Emergency Management for Leon County. I wondered if you could just give us an update on anything new that's come up at the county in terms of the county's response since our last call.
Yeah, we continue to engage in the activities mentioned last week, and primarily it's the collaboration with our partners. The partners here on the call. We talk with neighborhood and bond and the hospitals and the health department during several conference calls weekly on different issues. So we continue to facilitate that coordination. It's an opportunity for Claudia and her team at the health department to give the latest update, and we continue that process from the county's emergency operations center.
That's great. Thank you for that update. I've got some more questions on my list, but I want to circle back to some of the viewer questions. And there's a couple asking about these new strains of the virus that have come up, and how are the vaccines going to work on those. And so I'm going to look at Dr. Watson and Dr. Blake, and okay, Dr. Watson is the first one off mute. What can you tell us about that?
I've got to learn to stop doing that, Trey. I was just doing it so I knew where the button was. But now, so yeah, so 3 variants they're talking about, mostly UK, Brazil, South Africa. And remember, if you look at the CDC website, which usually has the most up-to-date information, the majority of the testing, or quite honestly, all the testing right now, is picking up these variants. And as a reminder, viruses in general all mutate. That's how they exist. That's how they live. They have to change by design to exist. So mutations in viruses are normal. Just like the flu, every year we have new variants. We have to come up with different types of vaccines. There's no difference when it comes to COVID. But currently, all of the studies are showing, and all of the reviews are showing, that the vaccines do work against all the variants currently. And I can tell you locally, because we get this question all the time, locally, all of our tests, including Florida State TMH lab, CRMC's labs they're all registering these variants. So there are no worries there. The treatments that we have in place don't vary, no pun intended, when we are treating these variants. And so, again, there's so much to learn about coronavirus. We're 9 months to a year in, and a lot to learn, but that doesn't mean you need to go out and get your vaccinations. Fear of things like variants should not be driving the conversation. What should be driving the conversation is using the resources we have now to prevent infections in the future. And the current vaccines we have are effective to do that.
Thank you for that, Dr. Watson. Dr. Blake, you want to add anything to that, or you want us to keep trucking?
No, I agree with that answer completely, and very fortunate that the vaccines are active against the variants. So I agree with Dr. Watson, and that has no place in the conversation for not getting a vaccine.
Great. By the way, if you have questions, please use the Q&A functionality to ask them, and then they will get funneled to me. So I wanted to, let's see, I had a follow-up for you, Ms. Blackburn, and that is, does the number of doses you mentioned include the second doses, or was that, can you just clarify the breakdown on that number?
Sure. The number that I gave is the number of individuals. It's not the number of doses. Okay,
great. And so, and there's also a question about second dose dates. So somebody's saying that they got their first dose on the 5th, were told to come back on February 2nd, but didn't get information on a time. Do they just show up anytime, or will they get clarification on that time when we get closer to the date?
They will receive an automated phone call and text if they have a cell phone from Leon County Health Department. The emergency management is doing that on our behalf, and it will tell them the time that they need to come and give them instructions. And that will happen within a couple days of their appointment. Earlier, if we can manage it, so. Okay.
And while I've got you, Ms. Blackburn, you've talked about working through this the list, right? Which was 8,000 last Friday, and so it's smaller than that this Friday. How many volunteers are working with you, and is that something that you need more of, or give us a little overview of that?
Yeah, well, we couldn't have done what we've done without volunteers at this point. We have had over 300 volunteers involved, many of them through Volunteer Leon, most of them through Volunteer Leon. They have helped call people to schedule appointments. They have worked various stations during the vaccination clinics. They have become part of our team. They're out there in the freezing cold and the rain. So lots of volunteers have helped and really made a difference. And, you know, more volunteers are always needed, and we would direct those people to Royal King at Volunteer Leon, 850-606-1970.
Okay, great. Thank you. Okay, wow, the questions are pouring in. I'm going to try to rapid fire through these because we're getting near the end. If someone previously had COVID and they're over 65, should they get the vaccine? Who wants to take that real quick?
I'll let Trey, I saw him click first. So
Go ahead. You beat him to the punch, Dr. Blake. Go ahead.
Yes, they absolutely should be taking the vaccine. Studies show that the immunity gained by the vaccine is much, much better than the immunity gained by a COVID infection. There are individuals that have caught COVID twice. So that tells you that the immunity infection is not good enough. So yes, if anybody who's had a COVID infection should still be looking to get the vaccine.
Are prisoners still being vaccinated? I see heads nodding yes.
the answer is yes.
Okay. So this is look, I know this is the last question y'all want to answer, but it's a question everybody has, and that is, can you update the timeline on when healthy under 65s may be able to get vaccinated? And if you can just narrow that down to a season, I think that would be helpful to folks. What's the latest on that? Nobody's coming off mute. Come on now. Somebody help me, Dr. Watson.
No, I would tell you, so that's everyone's shaking their heads no, but I would tell you that if everyone reads the literature every single day, I cannot emphasize how good this group is that is on this call, working together as a team. And I think that when you look at what's coming out, even with the Johnson & Johnson data that came out today, that if I were a betting man, and I'm not, I would tell you, you're looking at summertime where people are going to start to see vaccinations for the younger populations, maybe earlier than that, 90 days to 120 days, but that's what you're seeing in the literature right now.
Okay, great. Hey, here's a great question for you, Ms. Blackburn. How does the scheduling work? So the question from the viewer is like, how much advance notice do you get on what's coming in terms of new doses?
Well, we have been told what to expect in terms of our allocation. We get notified usually on Thursday what we're going to get on Monday.
Okay. Well, that's, I guess, better than no notice at all, right? So look, I want to just pause here for a moment and take this opportunity to thank our viewers on WFSU Radio. We're going to be signing off from that broadcast. We're going to continue this for just a few more minutes though, because the questions are so good, but thanks to our WFSU audience and I hope they have a great day. So I want to just go back to, I should have left a pause there. Let me leave a pause. Pause. Sorry about that, Kim. But man, the questions are absolutely pouring in here now. So I want to be sure, teachers, where do they fall in the pecking order? When will they be able to receive the vaccine? Ms. Blackburn.
Again, we really don't have any visibility into the answer to those questions. So we don't know what the governor's going to choose for the next priority area. And so it's really the governor's call as vaccine becomes more available.
Okay. Ms. Freeman or Dr. McMillan, there's a question about, has there been contact with elder care services to ensure that their clients are informed about the vaccine? Is that a group with which you're partnering?
Yes, definitely. Through United Partners with Human Services neighborhood, we're all members of that nonprofit community. So I've sent out notification to all of the nonprofits, including Elder Care Services, about being able to get those that are eligible for the vaccine vaccinated, and they have been responding. So yes.
Okay. Dr. Blake, I know we talked about anti-inflammatories and how they kind of work with the vaccine, and there's a question here about taking Tylenol or ibuprofen before you get the vaccine. What should that interaction look like?
Yeah, I read the question, and that person is correct. The current recommendation is not to prophylactically take Tylenol or ibuprofen before getting the vaccine. There was a small study years ago that showed in children only, taking those medications blunted the response. So the current recommendation by the CDC is not to take medicine before the vaccine, but it is okay to take medicine once you get the vaccine if you're having symptoms. There's no studies that show in adults that causes problems. And probably the most important thing to remember, both studies on both vaccines that showed 95% efficacy allow people to take Tylenol and ibuprofen. And there's no doubt that 50–60% of those people took those medicines and still reached that level of effectiveness. So that's the current recommendation.
Great. There's another question here, and there's been lots of anecdotes, not necessarily locally, but elsewhere, about leftover doses, right? And oh, well, somebody didn't show up, and so now we're going to use these in some kind of haphazard way. Is there any kind of sign up for that locally? How does that work, or is that more myth than reality? Ms. Blackburn.
There's not a special sign up for that. We either call people from our list, our waiting list already. We may have people, we may have a short list ready, or we give it to our partners to distribute depending on, how long it's good for after it's been defrosted.
Okay. Anybody have anything else to add on that? Okay. Winding down here, there's a question about is it safe for someone with a pacemaker or artificial heart valve to take the vaccine? Head nodding.
Yeah, it is. Yeah, they're all safe to be vaccinated. And again, just to keep referring folks back to the CDC website, all of those things are listed out and described. They're also described in the manufacturer's fact sheet that you can pull up. You can Google it or whatever search engine you're using. They're safe.
Okay. Let's see. My second dose of Moderna has been moved, but I haven't received a phone call at the time. Okay, so we've really kind of addressed that. And on the viewer who's asking about the participation in the African-American community, I refer the right honorable gentleman to the response that Dr. McMillan has given previously. I'll also tell you that that Elaine Bryant, former city commissioner, is going to be on this call to talk about that issue in a future webinar. So I thank you for that question. I think it's excellent. And I think that pretty much, I wanted to ask about the impact. We still get a lot of questions about the impact of in-person schooling on our community and on the drain on our healthcare resources. Does anybody want to just talk about it? Is that an issue or a non-issue for y'all in the healthcare world? Are you seeing it really drive your numbers higher or not? So seeing Dr. Watson shake his head no, and yeah, Dr. McMillan.
Yeah, and I'll let Damon can answer this too, but I just wanted to say a couple things. One is that there are plenty of studies out there in the pediatric literature that show that the in-person learning is safe. Now, I know you guys are going to get tired of this, but I'm going to push you to the CDC website and look at continuum of risk. It's called continuum of risk, and they have a nice listing of from lowest to highest models of mitigation. And Leon County, I will tell you, has done and this is with Claudia's team and others, has done a great job implementing these processes to make sure that our kids are safe. I've got kids in all levels, college, high school, et cetera here. They've done a great job with that. We have not seen a major influx of infections in the facilities. Our doctors are not overrun with pediatric cases or high school kid cases. The other thing I would say to that, and remember, it's a personal choice. If you want your kids to go to school or do it remotely, and that's perfectly fine. College is an interesting thing. We're in a college town, and that actually affects us a couple ways. One is that these younger folks do very, very well with COVID. So our mortality rate will not be as high because we have a younger population. But it also drives up our positive rate numbers because these kids are out socializing and doing the things they do. I've got college kids. And they end up infected. So, you know, it's kind of a double-edged sword. Your numbers go up, but your mortality rate is not climbing with them. We're not seeing them in the hospital. So that's a good thing. But again, with the pediatric population, personal choice, and they can get infected and they can spread it to elderly people. So that's the concern that you have to keep your eyes open for. And I'll let Damon, I don't know what I missed, but.
Just wanted to add the fact, and just a reminder, of course, our schools have been doing a great job of implementing the protocols that have been recommended. Screenings, temperatures, hand washing, sanitizer availability, social distancing, all of these measures do work. And as has been mentioned, of course, the pediatric and the younger adult population have been able to do, have not shown in-school transmission at high rates. So it shows that this is possible, and we just need to continue to be safe. Again, it's still a personal choice for each individual. If you have excessive risk and you're concerned about your child, you have to do what's best for your family, but it's been shown to do very well with the measures that have been taken.
Very last question, Ms. Blackburn. So I know the governor instituted a policy where you can't get a shot from out of state. What about people within the state that are kind of shopping for shots well away from where they live? So the question here is, could someone visiting Tallahassee from Manatee County get a shot? Do you need to be a local, however we define that, resident to get a shot?
You can get a shot anywhere you like. As a Florida resident, I will say with the new Share Care system, if you register in Share Care and you choose Leon and you live in Manatee County, then Leon is the place that you will go for both doses, and you will not be considered for any other county. So you need to choose your county carefully with the new system. But yes, you can go anywhere in Florida if you're a Florida resident.
Okay, I lied. One more question because it just came in, and I think it's a good one. And this is to Drs. Blake and Watson. How much longer do you anticipate the visitation restrictions staying in place at local hospitals? Dr. Blake.
Yeah, we're revising ours this week. There'll be announcements coming out probably today that we're going to go back to our normal previous visitation policy. We're doing that because, as we talked about earlier, our numbers are coming down nicely.
Wow, breaking news there. Dr. Watson.
Yeah, we monitor it week by week. We're not ready to make any changes yet. Can I say one other thing, Skip? It's going to veer just for a second, because I want to make sure that everybody heard what Claudia said at the beginning, and I think it speaks volumes for everybody that's on this call. And I have to quote, or Claudia and Manny's your help, you said 47 or close to 50% of 65-year-olds in Leon County have been vaccinated. And when you look at the people on this call, that's because of everybody that's been working together, the TPCAs of the world, the TMHPPs, the CHPs, the bonds, the neighborhoods, CRMC. It's a unique situation. I would ask everyone to compare our percentage to others in the state. And Claudia probably has that number. When we're approaching 50% and the rest of the state may be at 20, 22%, Claudia, correct me if I'm wrong, that's incredible. And I think that should be celebrated and recognized as really a standard. And Claudia, I don't know, what's the rest of the state? Do you know?
I don't know. You have to calculate it county by county. And I was nervous about giving that number because it is a really great number. Kevin checked my math and agreed with me. And we'll check it again internally. But I mean, I'm I'm pretty happy with that number, close to 50%. I would imagine in a couple days we'll be at 50 at least.
I can tell you through the distribution model and Claudia, I thank you every day, you know that when we get from the state and from the county any supply and we push it out, I can tell you TMH is approaching 40% of the community. Not just TMH, but the partners. I say TMH because I'm sitting here, but TPCA, CHP, Bond, Neighborhood, all of the TMHPP. I just want to say thank you. I mean, this has been a pleasure to work with everybody to get this out and take care of our citizens.
Appreciate you saying that, Dr. Watson, and this group coming together and this amazing thing. Kevin, anything else from you from Leon County?
Just continuing to work closely with Claudia to support her operation and ongoing conference calls with all of our partners, not just the group here, but many others. In fact, this afternoon, we got one of our larger primary healthcare partner calls that we do weekly. So we look forward to talking to everybody that we work with and continue these updates from Claudia weekly also.
Well, look, thank you to this group and thank you to our audience. We're trying to keep these tight to respect the time of not only our participants, but the folks that are taking time at their lunch hour to listen and learn. Continue to go to tmh.org/coronavirus. And of course, all these organizations also have resources to keep you informed, but that's where FAQs and copies of this rebroadcast of this events can be found. We will be here next Friday, same time, to continue to answer your questions. And so thanks again to all of the organizations represented here, to WFSU, to the Village Square. Be safe, everyone, and we will see you again this time next week. Thank you very much.